Hi, my name is Callie, and this is Lauren. She's going to be my patient today, and we're going to do an oral mech exam as well as a bedside swallow evaluation with food and liquid trials. So just to start off by noting that Lauren's position is good. She's in an upright position in a vertical angle, so she's ready to be doing some swallowing trials safely. She has good muscle tone. Just judging by talking to her, she's very alert. She follows directions well, and she is cognitively prepared for this evaluation. Looking at her face, there are no secretions coming from her mouth or nose, and she is not having an open mouth posture when at rest. Judging by talking to her previously as well as right now, she has good respiration at rest. I'm not hearing any sort of rattling or raspiness coming from her nose, and she is breathing through her nose, which is a good ability for her to have. And so just to start off, Lauren, I want you to hold your breath for 5 seconds. I'll count for you. Awesome. And now, before we get started, I am going to feel you do a dry swallow. So is it okay if I touch your neck? Mm-hmm. Okay. All right, go ahead. No! That's exactly what I did in room carrier, did it? It's okay. It's normal for the first swallow to feel a little weird because I'm touching your neck. So you can try again. It's totally normal for it to be weird the first time. Okay, go ahead and swallow. It's okay, go ahead and swallow. Okay, so whenever I said swallow, she immediately swallowed. So there was less than a second pause between me saying swallow and her swallowing. So that's excellent, and I feel comfortable to move on with the rest of the study. So I'm going to start by looking at her structure. So just looking at the outside, her lips are very symmetrical. There's no facial drooping. Now, Lauren, if you would open up your mouth. Is it okay if I look in there with the tongue depressor and light?
Yes.
Okay. So looking at her mouth, her tongue looks good. It's a good color. Her soft palate and facial arches are a good color. Everything is symmetrical. Her facial arches are very symmetrical. Her dentition looks good. I'm gonna look in your sulci. I'm just gonna move your cheek over. There is no pocketing or residue in her sulci, which is very good. Will you lift your tongue up? And the mouth floor looks good. Everything is symmetrical. So structure is looking excellent. All right, now I'm going to look at your lips. So I want you to start by just opening your lips like this. Now close. All right, now I want you to stick your lips at me, like, all right, pull them back, and then smile, okay? Now I want you to puff your lips up like a fish, and I'm gonna touch the side of your cheeks. Is that okay? Okay, she has a good labial seal. When I applied pressure, she was able to retain the air inside of her mouth. Okay, all right, so now I'm gonna put this tongue depressor in your mouth, and I want you to pinch it, and I'm gonna try to pull it out, and I want you to keep me from doing that. Okay, really good strength on her lips there. All right, so your tongue looks good. So now I'm gonna look at your tongue. So stick your tongue out at me. Okay, lift it up, down. Now go side to side. Okay, so that shows that she has good motion of her tongue. I want you to pull way back in your mouth like this. You go, go. Awesome. Now I want you to act like you have peanut butter stuck on the top of your mouth and clear that off. Awesome. Back, forward, and back. Great. Awesome job. All right, so now I want you to pretend that you have some stuff stuck in the side of your mouth and just clean that out like this. Great. All right, now I'm going to put some pressure. I want you to push against my fingers. Awesome. Other side. Excellent. So she has great tongue mobility and tongue strength. So next, I want you to, I'm going to look at your jaw. So open and close for me. Open, close. All right, now I'm going to apply a little bit of resistance and push against my finger. Awesome. No, close.
Oh, sorry.
Open again. Close. Awesome. Okay, side to side. I'm gonna put a little bit of pressure, push against. Awesome. Great job. Okay, stick it out at me and then pull it back. Excellent. So she has really good jaw mobility as well as strength. So now I'm gonna look in your mouth again. I'm gonna ask you to go ah, 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 and I'm gonna look at your soft palate. And then after that, you're gonna bounce it back and I'm gonna try to gag you. It doesn't hurt, it's just a second, it'll be really quick and then it'll be over, okay? And then after that, I'm gonna poke around your mouth and see if you can feel it, which I'm sure you'll be able to. So, all right. So go ah, 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 ah. Okay, so the movement is really symmetrical, both vertically and laterally. All right, now I'm just gonna bounce it back. And Lauren does not have a gag reflex, which about 20% of people don't have a gag reflex, and Lauren is one of those people, so that's pretty crazy. All right, so I'm gonna just touch around your mouth, and I want you to raise your hand on the side that you feel, okay? Okay. All right, great job. Okay, now I'm going to look at your laryngeal function, and that is what's going on in here when you swallow. So if it's okay, I'm gonna touch your throat when you swallow. But first I want you to hold out an ah, and I'm gonna see how long you can hold out ah. So are you ready?
Yep.
All right, go. Seconds. Wow, amazing job. So her ability to have the breath support to hold out ah and phonation is very good. And there was no bad vocal quality. There was no gurgling sound and no wet qualities. So that tells me that there's nothing sitting back in her throat that could be an issue and cause aspiration. So that is excellent. So now I want you to follow me as I raise pitch. So I'm just gonna go ah. You try.
Ah.
Awesome. Okay, so now give me a good vampire cough. All right, so that's a really strong cough, which is good. We all choke occasionally, and so that's excellent that she's able to give a good strong cough. Now, can you clear your throat for me? All right, awesome. All right, so now I'm gonna touch your throat, and I'm just gonna let you just swallow with nothing in your mouth, and I'm just gonna feel it if that's okay. Okay, go ahead. All right, and she swallowed immediately again, just like before. So now I feel ready to move on to liquid and food trials. So are you ready to try some of this delicious stuff we have in front of us? Okay. So to start, I am going to just give you a really small half a teaspoon of this water, and I'm gonna feel your throat as you swallow. And once you swallow, I want you to just say ah, and I'm gonna have you do that after every time you have water, okay? Okay. Actually, I'm gonna use this hand. Okay, say ah.
Ah.
Awesome. Okay, I'm gonna switch to this hand. This will work better. Okay, now I'm gonna give you a little bit more. This is a full teaspoon. Okay, It's okay. Okay, so now I'm going to let you just take a drink. Take one drink. I'm gonna help you to drink it. All right, I'm gonna give you one sip. Awesome. Okay, now you can take it and take your own drink. Take one sip, and I'm gonna feel. Okay, awesome. Now we're gonna use a straw, and I'm gonna pinch the straw so you can only get a little bit. I have this handy handle on my mug to make pinching very easy. Okay. Awesome. Okay. Now take one sip in the straw. Just one sip. Okay. And now you can take a sip. You can take several sips if you'd like, however you normally drink it. Okay. All of her swallows were pretty much immediate, less than a second. So now we're going to move on to solid food. So we're going to start with some pudding. So again, I'm going to just start by giving you just half a teaspoon. And you don't have to say all this time, but I am going to use my flashlight to look in your mouth and make sure there's nothing left over. So just a little bit, like half a teaspoon. Okay. All right. Just peek in there. All right. No residue left over, no pocketing in the self guide, and it looks good. Okay.
لا تنسوا الإعجاب بالفيديو والاشتراك في القناة.